Hi, I'm Steve Adebato. I'm here at Saint Barnabas Medical Center. I am pleased to introduce Dr. Rick Michaelson, who is the medical director of the cancer centers at Saint Barnabas Medical Center. Doctor, I want to thank you for joining us.
Thanks, Steve.
Talk to us about what differentiates your center from others who say they do the same thing.
Sure. Well, I think when people look for a cancer center for treatment, Steve, there really are two aspects that people need to look at. One is the level of medical care that's given, and that's obviously the #1 priority. But I think almost as important is the level of caring. And I think our cancer center has really put together these two aspects in a very unique way. Nowadays, cancer is a disease that's treated by multiple modalities: surgery, radiation, sometimes systemic medication. And it's really important at the beginning of treatment for all the involved specialists to come together and make a treatment plan for an individual person. So one of the things that we've done at St. Barnabas is organize frequent tumor boards specifically to individual illnesses, where patients' cases are presented to a number of medical oncologists, surgeons, radiation oncologists. We have radiologists, pathologists, if necessary, plastic surgeons and other reconstructive surgeons present, where the patient's case can be presented and all of the specialties can have input into what the optimal treatment for that particular person would be.
And Dr. Michaelson, the outcome for the patient, much better in a case like that.
No question. If you look at the outcome of most cancers nowadays compared to 20 years ago, the expected survival is clearly improved in many, many types of cancers.
One of the pieces that I picked up is something called a Navigator. Talk about that.
Sure. So we use our Navigator is really someone to help a person who's been newly diagnosed with cancer. We understand that just the word cancer diagnosis can put people into a tailspin. It's very difficult to think clearly and to deal with all the aspects of that at one time. So we have a patient navigator so that if a new patient calls into the center, he or she gets our patient navigator on the phone. Our patient navigator will very patiently take the information, will make whatever appointments that patient needs. And then when the patient comes to the center for the first time, introduce the person to the center, take them on a tour, let them know what services are available, and then turn them over to the physician and the physician's staff to then take it from that point on.
What really makes your team so special?
So I think there's a couple of things. One has to do with physician training. I can't emphasize enough the importance of training for a subspecialist. So someone who specializes in a disease like cancer. I think it's really important that people be trained at a top-notch cancer center where we can learn the way to logically approach a problem, to think through and work through a problem, and where you find the resources to get the answers that you need. We expect that the people who come to our center will get the same care as if they went to any other cancer center in the region. We also have physician specialization. Each doctor in our center has a specialization in a particular type of cancer. So I think really the philosophy of our center is one that if a person chooses to be treated at St. Barnabas, we become the advocate for that patient. That means that we walk through the whole journey with the patient and family. And that has many aspects. For example, in terms of the medical piece, we allot lots of time for new patient consults and follow-up visits to make sure that we can hear the concerns of the person and we can educate the person as to the status of their disease, options for therapy, and work with the patient and his or her family to decide what's the right treatment for them. We also understand how important communication is, and so at times that we're busy in the office, if a person has a question or concern, each physician has a nurse and an office assistant who's available to communicate by phone with patients, keep them informed, and hear if there are specific concerns. We also have a tremendous psychosocial support program. Actually, with no charge, we have a number of social workers who will do individual counseling, family counseling, group counseling. We can advise people on what to tell their children. We have an art therapist to work with adults and children. We have holistic nurses who do relaxation techniques for people undergoing treatment. We can tie into the wellness center and the integrative medicine center at the ambulatory care center, where they have nutrition counseling, yoga, acupuncture. And we also have a survivorship program where we give optional lectures in the evening dealing with all kinds of survivor topics, dealing from psychosocial, sexual issues to financial issues and job issues. When you become part of a person's life and you see that person doing well medically and or coping well emotionally with a difficult disease, that's the most rewarding thing.